Ever wondered why sometimes you feel dizzy or shaky when you haven't eaten for a while? It could be hypoglycemia. Hypoglycemia, or low blood sugar, is a condition that can occur in people with diabetes, but also in those without. It's essentially when your body doesn't have enough glucose, the primary source of energy for your cells. The most common cause of hypoglycemia is the use of insulin or certain anti-hypoglycemic therapies in individuals with diabetes. However, it's important to distinguish between fasting and postprandial hypoglycemia, as each has its own set of potential causes. The body's intricate balancing act of hormones, such as glucagon, epinephrine, cortisol, and growth hormone, also plays a crucial role in maintaining blood glucose levels. Understanding hypoglycemia is vital, not just for those with diabetes, but for everyone, as it underscores the importance of maintaining a balanced diet and healthy lifestyle. Stay tuned as we delve deeper into the fascinating world of hypoglycemia. So, what causes hypoglycemia? Let's find out. Hypoglycemia, or low blood sugar, often strikes people with diabetes who are receiving insulin or certain anti-hypoglycemic therapies, such as insulin secretagogues. For those without diabetes, it's important to differentiate between fasting and postprandial hypoglycemia, as each of these conditions invokes a different set of potential causes. Now, you may be wondering, how does our body normally keep our blood sugar levels in check? Well, this is where a group of hormones come into play. These hormones are like the managers of glucose homeostasis, ensuring that our blood sugar levels don't get too high or too low. First up, we have glucagon, a hormone that increases blood glucose levels by telling the liver to convert stored glycogen into glucose. Then, we've got epinephrine, also known as adrenaline, which stimulates the liver to produce more glucose and limits insulin release. Our third player is cortisol. This hormone helps to increase blood sugar levels by stimulating glucose production and reducing insulin sensitivity. And last but not least, we have the growth hormone, which also helps to raise blood sugar levels by reducing the body's sensitivity to insulin. This complex interplay of hormones helps to keep our blood sugar levels within a healthy range. But what happens when this system is disrupted? This is where hyperinsulinemia comes into the picture. Hyperinsulinemia refers to an excess of insulin in the blood, which can lead to hypoglycemia. To distinguish between an endogenous and exogenous source of hyperinsulinemia, we can look at C-peptide levels. C-peptide is a short peptide released into circulation when proinsulin is cleaved to insulin. Increased C-peptide levels signify an endogenous source, while decreased or normal levels point towards an exogenous source. So, these are the main players that keep our blood sugar levels in check. But how do we distinguish between different sources of hyperinsulinemia? This is where our friend C-peptide comes in. C-peptide is a short peptide that's released into the bloodstream when proinsulin is cleaved to insulin. It's like a backstage pass to a rock concert, giving us a sneak peek into the body's insulin production. Now, why is this important? Well, C-peptide levels can help us distinguish between exogenous and endogenous sources of hyperinsulinemia. If the levels are increased, it implies that the body is producing too much insulin on its own. That's endogenous. On the other hand, if the levels are decreased or normal, it suggests that the extra insulin is coming from an outside source, like an insulin injection. That's exogenous. So, in a nutshell, C-peptide plays a crucial role in helping us understand the source of hyperinsulinemia. With C-peptide, we can better understand the source of hyperinsulinemia. But what are some common causes of hypoglycemia? Hypoglycemia can be caused by a variety of factors. Let's dive into these causes, differentiating between those that occur during fasting and those that happen postprandially or after a meal. Fasting hypoglycemia can be categorized into two main groups, with hyperinsulinism and without hyperinsulinism. When hyperinsulinism is present, it means there is an excess of insulin, either due to exogenous insulin use, a reaction to certain medications like sulfonylureas or meglitinides, or to immune hypoglycemia where the body produces antibodies to insulin or insulin receptors, or due to certain drugs like pentamidine. A pancreatic beta cell tumor, also known as an insulinoma, can also lead to fasting hypoglycemia. On the other hand, fasting hypoglycemia without hyperinsulinism can occur due to severe liver dysfunction, chronic renal insufficiency, hypercortisolism, alcohol use, non-pancreatic tumors, or inborn errors of carbohydrate metabolism, such as glycogen storage diseases or gluconeogenic enzyme deficiencies. Now let's switch gears and talk about postprandial hypoglycemia. This type of hypoglycemia occurs after eating and can be caused by various factors, including alimentary issues, functional problems, non-insulinoma pancreatogenous hypoglycemic syndrome, occult diabetes, leucine sensitivity, and certain inherited metabolic disorders like hereditary fructose intolerance or galactosemia. It can also occur in newborn infants of diabetic mothers. Understanding these causes is crucial in diagnosing and managing hypoglycemia appropriately. Remember, each cause will require a different approach in terms of treatment and management, so it's important to pinpoint the exact source of the problem. Now that we know the causes, let's look at the clinical features of hypoglycemia. Hypoglycemia can manifest in many ways. It's often characterized by Whipple's triad, a classic set of symptoms that includes low serum glucose, neuroglycopenic symptoms, and rapid relief provided by administration of glucose. Men typically have a serum glucose level of less than 2.5 millimoles per liter, while women have less than 2.2 millimoles per liter. The symptoms of hypoglycemia can be divided into two main categories: adrenergic and neuroglycopenic. Adrenergic symptoms are the body's initial response to low blood sugar. They are caused by the autonomic nervous system activity and typically include palpitations, sweating, anxiety, tremors, and tachycardia. Neuroglycopenic symptoms, on the other hand, are caused by decreased activity of the central nervous system. These can range from mild symptoms like dizziness, headache, and clouding of vision, to more severe symptoms like mental dullness, fatigue, confusion, seizures, and even coma. When it comes to investigations, the first step is to check electrolytes, creatinine, liver function tests, and cortisol. If there's a suspicion of insulinoma, a type of pancreatic tumor that can cause hypoglycemia, blood work should be drawn when the patient is hypoglycemic. This could involve a hospitalized 72-hour fast, during which glucose, serum ketones, insulin, proinsulin, C-peptide, and insulin antibodies are measured. It's worth noting that C-peptide, a short peptide released into the circulation when proinsulin is cleaved to insulin, can be used to distinguish between exogenous and endogenous sources of hyperinsulinemia. If C-peptide levels are increased, this indicates an endogenous source, while decreased or normal levels suggest an exogenous source. Recognizing these symptoms and conducting the right investigations can lead us to a correct diagnosis. But how do we treat hypoglycemia? Treating hypoglycemia involves addressing the underlying cause. When we look at fasting hypoglycemia, the treatment must target the root of the problem. This could be anything from an exogenous insulin reaction, autoimmune hypoglycemia, to a pancreatic beta cell tumor known as insulinoma. In cases of postprandial or reactive hypoglycemia, the strategy is different. Here, frequent small feeds can help to maintain a stable blood glucose level. This type of hypoglycemia often occurs after meals and can be due to various reasons, such as alimentary causes, functional causes, or even hereditary fructose intolerance. In an emergency situation, when a patient is unconscious or not able to eat or drink, the treatment protocol varies slightly. In this circumstance, a rapid infusion of glucose is needed to quickly raise the blood glucose level. This can be achieved through intravenous administration of D50W, which is a concentrated glucose solution. Alternatively, if an intravenous line is not available, glucagon can be administered subcutaneously. In the case of an awake patient experiencing an acute hypoglycemic episode, the protocol is a bit more hands-on. The first step is to consume 15 grams of carbohydrates. This could be in the form of 3 packets of sugar dissolved in water, or 3/4 of a cup of juice. After waiting 15 minutes, the next step is to retest the blood glucose level. If it's still low, the process is repeated until the blood glucose level is stabilized. This approach allows the patient to take control of the situation and actively participate in their treatment process. It's important to remember that each patient is unique, and the treatment strategies may need to be tailored to their specific needs and circumstances. With proper treatment, hypoglycemia can be effectively managed. And that wraps up our discussion on hypoglycemia. We've learned a lot about hypoglycemia today, from its etiology and pathophysiology through the pivotal role of C-peptide to the common causes. We've delved into the depths of this medical condition. We've also examined its clinical features and how to investigate it effectively. Finally, we explored the different treatment options and how they can be applied in various situations. Understanding hypoglycemia is not just crucial for medical students, but also for the general public. It's a condition that can affect anyone, so being aware of its signs, causes, and treatment methods can make a significant difference. Remember, knowledge is power, and in this case, it can also mean better health. So keep learning, keep exploring, and keep asking questions. Thank you for watching. Don't forget to subscribe to MedSign Health 360 for more informative videos. Please share your thoughts and feedback in the comments section below.